Hello friends, we're going to be talking about the EpiPen today. EpiPen is basically an epinephrine auto-injector. It can come in many brands, many forms, but this is given to people who have anaphylaxis, which is a severe allergic reaction. It can be to certain foods, it can be to stings, animal stings, it can be to a lot of things, and your doctor who prescribed you the EpiPen will tell you what to use it for. For the most part, it's given for food allergy like peanuts, shrimp, or something. So let's discuss when to use the EpiPen. When do you use it? So if you're exposed to a known allergen, like for example, if you know that you have peanut allergy and you ate something that has peanut, maybe a chocolate or an ice cream or a cookie, even though you should try your best to avoid it, but accidentally if you ate something and you start to have symptoms. So what these symptoms mean? So if you just have hives on your body, which is like the red raised bumps which are really itchy, that's just one symptom. So you need to have at least two symptoms for you to use the EpiPen. So for it to be classified as anaphylaxis, it has to be two systems. So skin is one system, and then another system can be just your gastrointestinal system. So if you're vomiting, if you're feeling uneasy in your stomach, like if you feel like having a diarrhea, or that is your gastrointestinal. Then the other system is your lungs. So if you feel short of breath, if you're feeling wheezing, if you're feeling like it's hard to breathe, your chest is tight, or you're coughing a lot after eating something, and you have like hives or vomiting, then the third system, and this is the most dangerous system, is your cardiovascular system, your heart. So if you're exposed to an allergen that you are allergic to, and the biggest risk is that your blood pressure may drop suddenly and you might go into what we call a syncope. So which is basically you just pass out or you become unconscious because your blood pressure goes so low, and that is a life-threatening condition, and you really need to use your EpiPen for that. So anytime you're diagnosed with an allergy, your doctor will give you an EpiPen. And a lot of times I've seen in my clinic, especially, most of the patients that I give EpiPen to, around 80% of them do not carry the EpiPen with them at all times. So this is a life-saving device. This is a life-saving medication. This needs to be on you, on your body. So it has to be there in your bag, in your pocket. This is as important as your key or your wallet, and it has to be with you at all times if you're severely allergic. The other thing is need to know how to use it. Again, a lot of the patients that I see in my clinic, and if they carry their EpiPen or if they don't carry their EpiPen, they don't know how to use it. So today I'm going to teach you how to correctly use the EpiPen. So this is what it looks like. This is a trainer. A lot of them might not look like this, but the basic idea will be the same, that it will be an auto injector device, and usually the color codes are also the same. So it's intuitive. Usually there's something written on it, so you just hold it that way and it goes down. But if you forget, then blue to the sky and orange to your thigh. Blue to the sky and orange to your thigh. Now let's imagine that this is my thigh. The first step I do is to remove the blue cap, so it comes off, and then I take the orange and I inject it on my thigh. I do not need to remove my clothes. The needle here is pretty big. It can go through your clothes even if you're wearing jeans or whatever. So this is an emergency medication. Don't wait to remove your clothes. Orange to the thigh, and go at 90 degrees to your skin, and with force you should hear that click sound. Okay, and then wait for 10 seconds after you hear the click, and then take it out. Okay, this is what it will look like. And this is a trainer. This is not a real EpiPen. Every time you purchase an EpiPen, you get it from the pharmacy, you will get a trainer to practice on. So make sure you open the box, you practice on the trainer, and get comfortable with it. This is very important if you have an allergy. Okay, so we discussed when to use it, how to use it. Always carry it on yourself, and make sure that it's not expired. Okay, it has a relatively short half-life, maybe 1.5 to 2 years. Okay, so if you've not used it, if you don't remember when you got it, just check your EpiPen and make sure that it has not expired. The other thing to remember is that after you use the EpiPen, it is recommended that you call 911 and visit the emergency department. Now, there is recent debate about whether you should really go to the ED or not. If you get one dose of the EpiPen and you notice significant relief in your shortness of breath or in your hives, a lot of times hives take longer to resolve, but if the shortness of breath resolves, if the stomach upset or the vomiting or like the feeling that you're going to pass out resolves, then you can wait and see. If you feel like you need another dose, usually the epi auto injector comes with two auto injectors. Take another dose in 15 minutes and go to the ER. If you feel like your symptoms are much better, you can stay at home, observe yourself for 4 hours, and if you feel anything, please go to the ER. However, in case of doubt, it's always good to go to the ER, get yourself observed, because there can be what we call a biphasic anaphylaxis, where it resolves and then it comes back. So you don't want to do that. This is the life-threatening condition and you want to take it seriously. Okay, if in doubt, always keep this video saved, like create a WhatsApp group with yourself or just any place where you keep your videos saved, and just see the last 30 seconds of this video if you ever need to take it and you don't remember how to take it. So I'm going to go over it again. Blue to the sky, orange to the thigh, don't need to remove your clothes, go at 90 degree, go really hard, remove the cap, go really hard, and hear the tuck sound. Once you hear the tuck sound, wait for 10 seconds, remove it. Okay, and when do you use it? Two systems: skin and your stomach, or skin and your breathing and your stomach, or you feel like you're gonna pass out. Okay, thank you.